This is an example of a community clinical chat in the Pollock House here at UW Oshkosh College of Nursing, accelerated BSN program. You can see the students as their avatars sit around in a circle, and we will now listen in on the convo a little bit, see how it goes.
One of them speaks very little English to the other. On the other side, the other one speaks quite a bit of English. But we do have an interpreter that comes in once a month when we do our care conferences and revise care plans for each of the patients, which I will get to see next week, which I'm pretty excited about. Otherwise, there is not usually an interpreter on staff. So if we do have anything that really needs to be discussed, we have to use language line. But we do have.
I work at a home health agency, and there's not a lot of cultural diversity, like when it comes to like interpreters or anything. But the hospital is located very close to an Indian reservation, and a lot of landing different.
This is Kelly, and I'm in public health department, and so I haven't really encountered any personal patients that have been of any other culture, different culture, subculture. I did watch as an interpreter worked with a Spanish woman who brought her child into us because she was worried that talked to my preceptor, and I guess we were just so busy we never went back to him. So I guess I kind of saw that how easily those people can fall through the cracks.
I work at a home health agency, and I haven't really had a lot of experience with a lot of cultural diversity other than the fact that there's a lot of Native Americans around because it's next to an Indian reservation. And I think that I just wish that our agency would ask a special question, because they don't ask any questions about their cultural practices or anything like that. So I kind of wish that they did that more often at our agency.
My preceptor consistently asks is about spiritual practices, especially with hospice patients, and if they want any pastoral support or anything like that to come in for hospice or anything like that. Another thing that I've noticed that you have to be really careful about, it's not so much culture, but just the level of the patient's understanding. We've had some patients that are nurses and they understand very.
Hi, this is a community group chat taking place in the Pollock House rendition on UW Oshkosh College of Nursing campus. Let's listen in.
Very different, and I think that you need to be aware of that whenever you're walking into a house or dealing with patients.
This is Amy. I'm working in a public health department, and the city that I'm working on is actually pretty diverse. We have two Spanish interpreters who I've worked with actually quite a bit, and also I have kind of an interesting case right now where we're working with Somalian refugee who is also has, and as soon as they started her on, she just, at dialysis, she was refusing heparin, and that's because for her religion, they're not supposed to have any pork products, and so she's having some difficulties with her shunt, and we had to talk to the family about her health and how she really did need the heparin. I know there is a beef form of heparin available, but I don't think it's offered there, so it was just kind of interesting to work.
I also work in, I've done a little bit of public health, and then I've gotten the opportunity to do a little bit of home health too, but the only real cultural diversity or cultural experience that I've had is with the WIC clinics that I have attended. I attended one WIC clinic that was entirely Spanish. Nobody spoke any English. So I guess I have 2 points that I'd like to make.
During these chats, of course, no names are mentioned, no agency names are mentioned in order to preserve the confidentiality of all statements made.
And so for me, it was a good learning experience because it it really demonstrated how much of a communication barrier there can be if there's not an interpreter present or someone that speaks the language. So that's my first example. And then my second example actually just happened a couple days ago, and there was a Hispanic mom who she has one child who's 3 or 4, doesn't matter, but she breastfed that child, and she's...
In order to provide confidentiality, no names are mentioned of agencies nor patients during this chat.